Hello, my name is Faz Pakarian. I'm a consultant gynecologist with over 25 years experience. I practice in the NHS and two private hospitals, namely the Montefiore Hospital in Hove and Goring Hospital in Goring. Today I'll be talking about menstrual disorders, which I would like to describe as a broad topic, which includes painful heavy periods, unscheduled vaginal bleeding whilst on HRT, and postmenopausal bleeding. Painful and heavy periods are a common debilitating disorder, and I tend to see lots of patients coming to both my NHS and private clinic. But essentially, most patients would have seen their GPs and would have tried different types of the pill, the Mirena coil, for symptomatic relief. However, most patients would have not been investigated. I offer a one-stop clinic where, following a detailed history and examination, I tend to carry out a pelvic scan to assess whether there are polyps or fibroids in the cavity of the uterus, or look at ovarian cysts. If the ultrasound appears normal, then I will offer a laparoscopy. The laparoscopy tends to exclude conditions such as endometriosis, inflammation in the pelvis, or pelvic infection. All these conditions may contribute to the symptoms of heavy and painful periods. I think it is really important to make that diagnosis. I would also like to talk about unscheduled vaginal bleeding whilst on HRT. HRT is commonly used in patients. As an example, in 2021, there were 1.9 million prescriptions for HRT. This was a 35% increase in the number of prescriptions when compared to the preceding year. HRT is used in approximately 1 in 6 patients over the age of 50. In the first 6 months, HRT may be associated with vaginal bleeding, which can cause anxiety for patients and occasionally their GPs, and hence referral to the hospital. It is really important to be able to reassure the patient and to offer a scan to assess the thickness of the lining of the uterus. A scan is part of my management when I see my patients. Following a full history and examination, I carry out an endometrial thickness scan. If the endometrial thickness is greater than a certain degree, I offer an endometrial biopsy or a hysteroscopy. Hysteroscopy is popping a camera inside the cavity of the uterus to assess the lining and to exclude polyps. The other point I'd like to briefly discuss is postmenopausal bleeding. Postmenopausal bleeding is bleeding following menopause. Menopause is a retrospective condition in that if you've not had vaginal bleeding for 12 months and any further bleeding that occur after this period, it is regarded as postmenopausal bleeding. 90% of postmenopausal bleeding is benign, but 1 in 10 can be associated with abnormalities inside the cavity of the uterus. Once again, I do offer a one-stop clinic where, following a full history and examination, I offer a scan to assess the endometrial thickness.